now we are going to continue where we left in the previous video. We have done about the root of lung, the pleuras, the parietal pleura, the visceral pleura. We had done it in previous video. Now we are going to learn about the bronchial arteries. Okay, which bronchial arteries supply the right lung and which bronchial arteries supply in the left lung, how they are originating, okay, how they are going until what is their extent. Okay, so we are going to listen to all we are going to learn all these things in this lecture. So bronchial arteries, for the right lung we have only one bronchial artery. Okay, for the right lung we have one bronchial artery, and it arises from right third posterior intercostal arteries. And intercostal arteries we have discussed in our videos that are intercostal spaces videos. In our intercostal spaces videos we had a thorough discussion on the posterior intercostal arteries, the anterior intercostal arteries. If you have yet not seen those videos, please go and check them out. Okay, so right third posterior intercostal artery, okay, you have to see from the intercostal spaces video. So bronchial artery for the right lung arises from the right third posterior intercostal artery, or it may also arise from left superior bronchial artery. Okay, but most commonly it is arising from the right third posterior intercostal artery, and the chances of its chances that it arises from the left superior bronchial artery is very slim. Okay, so if I'm talking about the left lung, then we have two bronchial arteries over there. We have two bronchial arteries. The two bronchial arteries are as left superior and left inferior. The two bronchial arteries are as left superior and left inferior bronchial arteries, and these are the branches of descending thoracic aorta. Okay, so for the right lung we have one bronchial artery which arises mainly from right third posterior intercostal artery. For the left lung we have two bronchial arteries, that is, first is left superior and another one is left inferior bronchial artery, and these arise from descending thoracic aorta. Okay, now the bronchial arteries supply the tracheobronchial tree till the respiratory bronchioles. So bronchial arteries are those arteries which supply the tracheobronchial tree up to the respiratory bronchiole. Okay, so bronchial arteries supply the tracheobronchial tree up to the respiratory bronchiole, and it doesn't supply after the respiratory bronchiole. Okay, so bronchial arteries for the right lung we have one bronchial artery which arises from the right third posterior intercostal artery. For the left lung we have two bronchial arteries, left superior bronchial artery, left inferior bronchial artery, and they arise from they are the branches of descending thoracic aorta. Okay, now please tell me that the bronchial artery of the right lung arises from the right third posterior intercostal artery. Okay, and from where the right third posterior intercostal artery arises? So right third posterior intercostal artery arises from aorta only. Okay, so this is clear. And if you want a complete picture of how the right third posterior intercostal artery is arising from aorta, please go and have a look at the intercostal spaces section. So next is the mediastinal surface. The mediastinal surface of the right lung and the mediastinal surface of the left lung. It is a most important topic, and you may get a 4 marks question onto it, of the mediastinal surface of the right lung and the mediastinal surface of the left lung. Okay, so if I'm talking about the right lung, onto the mediastinal surface of the right lung we can see a groove for esophagus, we can see arch of azyagus. Okay, we can see arch of azyagus, we can see trachea, and inside the trachea we can see the right vagus nerve also. Okay, this is right brachiocephalic vein, this is superior vena cava. Okay, and this is inferior vena cava, and if this is the superior vena cava and this is the inferior vena cava, this is what? This is what? This is right atrium. It is understood from superior vena cava and inferior vena cava only. This is the right phrenic nerve we can see. So onto the mediastinal surface of which lung? Of right lung, we can see a groove for esophagus, we can see arch of esophagus, and arch of esophagus we have also seen in with the relation of the root of right lung in our previous video. So we can see esophagus, we can see arch of esophagus. In trachea we can see right vagus in the trachea, we can see right brachiocephalic vein, we can see superior vena cava, we can see if we are seeing superior vena cava and inferior vena cava, we can see right atrium also, we can see right vagus nerve, we can see right phrenic nerve. Okay, so all these things can be seen on the mediastinal surface of the right lung. This diagram is very important. You can take a snapshot of this diagram and you have to draw this diagram into your examination. I can clear it all these markings so that you can easily take a snapshot and use it in your for your further reference. Okay, you can take a snapshot. This is a full screen display. Okay, so next we are having a look at the mediastinal surface of the left lung. So onto the mediastinal surface of the left lung we can see the following structures. Okay, firstly we will observe what? We will observe left common carotid artery, left subclavian artery. This is left common carotid, left subclavian artery, and along this what we can see is this aorta. The main thing that we can see is the aorta, and we have also seen aorta with relation to the left root of lung in the previous video also. So you can make it out that if aorta is present, then left common carotid artery and left subclavian artery will be obviously present, because there is no confusion in that. If you are done with the formation of the aorta, you know why common carotid artery or left subclavian artery are present or are arising from here. And if you haven't done it, we are going to post the video of formation of aorta shortly onto our channel after we complete the gross of thorax part. Now what I can see is the trachea over here also, the esophagus over here also. The trachea and esophagus are common. Then we can see the thoracic duct also, and this is understood. Okay, here and left, and if there was right vagus, now here will be left vagus and recurrent laryngeal nerve, and here we can see the left ventricle. Okay, and this is the left phrenic nerve. There was right phrenic nerve and right vagus. Here it is left phrenic nerve and left vagus and recurrent laryngeal nerve. So onto the mediastinal surface of the left lung we can see what? We can see aorta, we can see left common carotid artery, right common carotid artery, we can see trachea, we can see esophagus, we can see thoracic duct, we can see left vagus, we can see recurrent laryngeal nerve, we can see left ventricle, we can see left phrenic nerve. Okay, so you can take a snapshot of this picture also. I am cleaning it up. Okay, so you can take a snapshot of this and do attempt the test whose link is given in the description. Okay, so if you are new to this channel, please like, share, subscribe and comment. Okay, thank you very much for watching. Have a great day ahead.